Hi, good morning, everyone. From who's watching from Facebook and on our Zoom, we will start at exactly 10 a.m. Thanks so much. Hi, good morning, everyone who's watching from our Facebook page and, of course, who are here in our Zoom meeting. Before we start, let me introduce myself. I will be your host for today's webinar. I'm Reynel Del Rio. I'm the Client Acquisition Officer of Ruman Associates Immigration Services po. So, before we start, our topic for today is how to become a healthcare assistant in Canada. Of course, let me introduce first our company. We have our own immigration consultant. His name is Mr. Israel Roman. His consultant identification number is R524540. And of course, he's a licensed Canadian immigration consultant and he's an active registered nurse in Canada. And of course, our offices is located at our main office is actually already in Canada in 6057 Dumont Road in Nanaimo, British Columbia po. And of course, our satellite office here in the Philippines are located at President JP Laurel Highway, Lipa City here in Batangas po. Of course, if you want to visit us, you can always go to our office here in Lipa, Batangas from Monday to Friday po. 8 a.m. to 5 p.m. po, we're open. And of course, before I start, let me give the credential of our immigration consultant and our company. Of course, as I mentioned, we have our own licensed Canadian immigration consultant. He's registered with College of Immigration and Citizenship Consultants. And of course, our company, Roman and Associates Immigration Services Limited, is a registered Canadian immigration firm in BC, Canada. And you can always check our legitimacy to Canada Business Registry. Just go to that website and just search our company name, Roman and Associates Immigration Services po. And of course, as I mentioned, our immigration consultant is a practicing registered nurse in Nanaimo in Canada. Of course, you can always search him through any website like Google. Just simply type his name, Israel Roman po. And of course, our topic for today is how to work as a healthcare assistant in Canada. So, sino nga po ba yung mga qualified mag-work as a healthcare assistant in Canada po? Of course, the first thing you need to do is you need to apply for a registration with Health Worker Registry. And of course, in BC Care Aide and Community Health Worker Registry po. And before you do that, for an international educated healthcare professional po or graduate of healthcare assistant programs outside the Canada po, the requirement for you is you must be residing in Canada na po. Yes po. Flash on your screen. The requirement for you is you should be in Canada na po talaga. But how can we help you to work as a healthcare assistant nga po in Canada? Of course, the first thing you need to do is later we will have our representative from Stenberg College that is Ms. Jenny Calicerio from Stenberg College. And of course, as I mentioned, we have our partner school, Stenberg College. And as here in Roman and Associates Immigration Services, this will be your gateway in studying as a healthcare assistant in Canada and also working as a healthcare assistant in Canada. Of course, we will help you to achieve your dream po. And of course, the best option to come to Canada as a healthcare aide is you need to apply for a study permit po. Yes po. For the applicant outside the Canada po, you should take the study permit po. And of course, what course? The course or the program you will take is a healthcare assistant program or course po. And of course, you will get that program on our partner school, Stenberg College po. And of course, after applying a study permit and taking the course healthcare assistant, what are you going to do? So after that, After studying and taking that program, you can now apply for a work permit with LAMIA. Then after that, of course, you can now apply for a permanent residency under the Caregiver Pathway Program. Or if you want to continue your study, of course, our partner school, Stenberg College, also offers different courses like postgraduate diploma in Canadian nursing and also early childhood education. So actually, they have a lot of courses that can offer to you. Depende na lang po sa atin if you want to continue your study program po. And after that, after knowing po, let's say, you already finished your program healthcare assistant in Canada, the question we always encounter here is, sir, yes, nag-study ako sa Canada, kinuha ko yung program na healthcare assistant. Is there really a job waiting for me after my program? So, flash on your screen, makikita nyo po dito, gaano kadami ang available jobs waiting for you as a healthcare assistant in Canada, depending on location, syempre. For example po, you want to work in British Columbia, flash on your screen, the available jobs waiting for you is 117. And if you want to work in Lower Mainland, the available job is 53, so on and so forth. So, makikita nyo sa slides po na to na kung gaano kadami yung work or available jobs waiting for you as a healthcare assistant or aide in Canada po. And of course, the question we encounter again is, yes, sir, may available jobs waiting for us as a healthcare assistant in Canada. Magkano naman po ang kinikita or magkano naman po ang salary as a healthcare aide in Canada po? Of course, flash on your screen. Always depende po sa location or area kung saan po tayo mag-work. Depende po kung magkano po yung salary po natin. For example, you will work in British Columbia. We have, as you can see, flash on your screen, we have 3 different wages po. We have the low, median, and high po. So low, median, and high, these are the categories where your employer belongs in terms of their financial capacity to pay towards their employees po. So for example, in British Columbia, you're working po for the low wage, you're earning as much as 18 Canadian dollar per hour. In median, 22 Canadian dollar per hour. And in high, you're earning as much as 25 Canadian dollar po. In Cariboo region, you're earning as much as 18. In median, 21.85. And in high, you're earning as much as 24.86. So on and so forth po. And after knowing kung magkano nga po ba yung kinikita ng healthcare aid in Canada, the question again is, yes, sir. Let's say tapos na po ako sa isang employer ko. Tapos na po yung contract ko. Is there really a job pa rin pagkatapos ng first contract po natin? So, flash on your screen, makikita nyo po the job opportunities over the next 3 years po. So, syempre, depende pa rin po siya sa location kung saan po tayo nakalocate sa Canada or kung saan po tayo mag-work sa Canada. So makikita niyo po sa screen na to kung gaano kadami yung job prospect po na nag-aantay sa inyo na even matapos na po yung first contract natin, let's say as a healthcare assistant or healthcare aide, is marami pa rin po tayong option. So definitely, hindi na natin kailangan bumalik kung saan country tayo naka-reside po. So definitely, our goal here is to become a permanent resident. And syempre, we live in Canada na po. And syempre, mag-retire na din sa Canada po. So after knowing that, after knowing kung magkano, kung may job nga po ba na nag-aantay sa atin, how much is the salary, what are the job opportunities over the next 3 years, bibigyan ko po kayo ng sample if how much po ba yung na-earn natin as a healthcare assistant po in Canada. So, as a healthcare assistant in Canada, this is your hourly rate po. Pero syempre, depende siya sa location po natin. For example, your salary range is 25.83. So, let us compute that. So, for example, the sample wage computation for a healthcare assistant is, for example, you're earning as much as 25.83 per hour. and you're working 40 hours a week, you're earning as much as 1,033.20 Canadian dollar per week po yan. And in a month, you're earning as much as 4,132.80. And in a year, as a healthcare assistant po, you're earning as much as 53,726.40 Canadian dollar po. Yes po. Let's try to convert it to peso po. So for example, the Canadian dollar is 43, you're earning as much as 2.3 million in a year as a healthcare assistant or healthcare aide in Canada. So the question here sa mga nanonood po sa atin from Facebook and on our Zoom, for example, you're a registered nurse here in the Philippines and looking for, let's say, 10 to 20 patients a day. Do you think you can earn as much as 2.3 million in a year as a nurse here in the Philippines? So definitely, the answer is no. We cannot earn as much as 2.3 million as a registered nurse here in Canada. And of course, as a nurse here in the Philippines, alam natin na nakakapagod mag-alaga ng 10 to 20 patients a day po. So, of course, the other another job you can get for a healthcare aide is you can apply for an in-home caregiver. So ano nga po ba or what is in-home caregiver? In-home caregiver this is more on taking care of an elderly patient po. So let me give you an hourly rate on how much are you earning as an in-home caregiver po. So for example, depending on community and area in Canada, let's say we have 3 different categories pa rin po. Let's say in Canada, you're earning as much as 12.91 in low, in median 16.85, and in high, you're earning as much as 24 Canadian dollar po. In Alberta, low 15, median 18, and in high 28.85. So on and so forth, depending on the community or area kung saan po tayo magtatrabaho as a in-home caregiver po. So let me give you a sample computation on how much are you earning nga po ba as an in-home caregiver in Canada po. Of course, if you're working 40 hours a week and earning as much as 16.85 an hour, you're earning as much as 674 Canadian dollar in a week. And in a month, you're earning as much as 2,696. And in a year, you're earning as much as 35,048 Canadian dollar po. And of course, let's convert it to peso. You're earning as much as 1.5 million as an in-home caregiver in Canada po. Of course, the question again here is, if you're a registered nurse here in the Philippines, do you think you can earn as much as 1.5 million pesos? So definitely the answer is not po. And also, as I mentioned, in-home caregiver, definitely you're looking for 2 to 3 clients or patients per day lang po. So definitely, here in the Philippines, working as a registered nurse, definitely pagod tayo working, looking for 10 to 20 patients. And in-home caregiver in Canada, you will look for at least 2 to 3 person or client per day po. And of course, what are the advantages in joining with us nga po? So as I mentioned, we are partner with a college that delivers exceptional education, and that's the Stenberg College. And we have a reasonable administrative fee. We have 50% off on our professional or consultant's fee. And of course, you will have your job security. Lahat naman tayo, lahat na nag-a-apply, we want our job security in Canada. Of course, you will have an employer with LAMIA na po. And of course, you have a multiple option to stay in Canada after you study. Yes po. Hindi nyo na po kailangang bumalik sa Philippines after you study in Canada po. Definitely, sobrang dami ng opportunities po waiting for you here in Canada nga po. And of course, with that, I will now transfer the hosting to Ms. Jenica para ma-discuss niya po sa inyo ang aming partner school, Stenberg College, and the program Healthcare Assistant po. So with that, I will now transfer it to Ms. Jenica po. So...
Hello, good
Ayan.
morning, everyone.
Hello, Miss Danica.
Hello, good morning. All right, so there you go. Okay, my name is Jenica, and I will be discussing the program that we deliver here at Stenberg College. I'm gonna share my screen with you. Rainiel, paki-confirm na lang if nakikita ba ninyo yung screen ko.
Yes, ma'am. Kita po.
Okay, thank you. All right, so for those of you who are watching on Facebook and the ones that are here in Zoom, so you want to go to Canada and tinitingnan nyo yung prospect of enrolling into a healthcare assistant program. So we have that program with us at Stenberg College. But first, I'm going to share with you our introductory video before I start anything. Okay, so to give you a bit of an overview of our school, Stenberg College has been around for over 30 years. We are a DLI, we're a private post-secondary college. We were founded back in 1990 by Mary Jane Stenberg. So we originally were delivering nursing programs. And because of the success of the nursing graduates, we were able to expand into offer other programs such as education, human services, and business. But for today, we're only going to discuss the healthcare assistant diploma. So we're a well-established medical college located in Surrey, British Columbia. For those of you who are not aware yet, Surrey is part of Vancouver. So we're just about 40-minute train ride away from Vancouver downtown. But for students, very beneficial for you to be living in Surrey because in Vancouver, it's a well-known fact, medyo mataas ang cost of living natin sa Vancouver, no? But it's, if you really do the calculation and compare it with other major cities in other provinces, it's actually almost the same lang. But if you live in Surrey, you're actually saving about 21% on cost of living as it is a bit lower. Pero you still have the access to all of the opportunities in Vancouver. Okay, kasi malapit lang naman talaga. And some of our students, they live there as well. And one of the things that really separate us from other institutions is that we have a very strong employer and industry relationship. So this is something that I'll be discussing more later on. All right. So when you become part of Stenberg College, we provide you with all of the support and services, and we are fully aware sa mga needs, pangangailangan ng mga international students. But I wanna just highlight two of the services na we want you to really take advantage of. Number one would be the academic support. So when you're studying in Canada, if you're an international student, you will be allowed 20 hours per week of work while you're studying. And the reason that I'm highlighting the academic support is because there is a tendency for us Filipinos, very ano tayo masisipag tayo when it comes to work, right? We don't want you to forget about studying because you are going to be under a student visa. So take advantage ninyo yung opportunity to really discuss topics with your instructors. You can have that separate session if that's something that you need. You can also join free English classes if you want to improve on your English communication skills. Some of our students, this is not common here in the Philippines, but some of our students, they even avail of our life coach. It's for free. The life coach just helps you, especially sa the first 3 months nyo siguro when you're already there. The life coach helps you with adapting to your new environment and balancing your student life, your work life, tinutulungan kayo with your schedule. And feedback from our Filipino students, malaking tulong si life coach sa kanila, especially na nagsisimula sila. So if that's something that you think you need, you just let us know. Also, what you can expect is that we have a smaller class size. This allows the students to really be engaged in classes and ask their questions. So we find that it's a more conducive environment for learning kapag konti lang ang ating mga estudyante. Now, when it comes to your career sa pagdating sa employment, we want to highlight our service on career services. Now, you will meet them during the orientation. And what they do is they assist you pagdating sa employment ninyo. They will ask for your resume para matulungan kayo to rewrite it or to improve it in a Canadian standard, or if you need simulation exercises for interviews, they can do that with you as well. And they also connect you with employers. So if you're going to look for part-time employment and even the full-time employment after the completion of your program, career services will be assisting you. So now let's talk about the healthcare assistant program. So I have a short video here that will give you more insight on what the healthcare assistant does. So let me just play this video for you first.
I have nothing but respect for the healthcare assistants, because if it weren't for the healthcare assistants, the nurses don't know the patients or the residents the way that the healthcare assistants do. They are the first line of defense, if you will. They come to you and they know when your patient is having any kind of a bad day or a good day. They know them way better than I do as a nurse. And so I 100% depend on the healthcare assistants to come to me with whatever needs to be done for that patient. What I first noted about Stenberg College right away when I started here was that there are so many resources available to the students, and the faculty and the school itself really cares about the success of Stenberg College students. What particularly impresses me about the HCA program here is the in-depth and breadth of knowledge and curriculum that is taught. It's not only just the provincial curriculum that's being taught, but it goes further so that the healthcare assistants can understand the diagnosis, not just what to do when this person has this. If they fully understand it, then they're going to do better in their career.
Our HCA program, I feel, is one of the best because of the simulations lab, the nursing lab, the way that they have integrated the nursing instructors to be able to have them in the same classroom, sometimes in the same lab as nursing students. So they have that cross-pollination of information with each other.
I get really excited when I teach, and I'm sure some of my students, if asked, would say this about me. I'm not just talking about diabetes, for example. I get involved in the background of it and then how to care for said person with diabetes. And so what I hope to pass on to my students is to get excited about it and not just treat it as just a job. It's not just a job that pays the bills. You're helping people, you understand, you do this and this is the rationale for it. And to be able to help people, and not only the patients, but their family and their extended family and the colleagues that you work with, I think it's really exciting for me, both on the floor, nursing, and to instill that into my students. What I like my students to take away from the classroom, not only into their clinical, but into their careers, is the ability to believe in themselves and that they really are making a difference.
Growing old is inevitable, I suppose, and from my point of view, I just do the best I can for myself and for other people. I really think that here the staff are wonderful, and I'm just thankful that I'm in a place like this.
Before the HCA program, I was a housewife and I have regular jobs, but not a career.
Coming to Canada, I have like big dreams. For a starting point, it is very hard. I got like little bit confident. Okay, I can work in a gas station, and I started working there. But going and coming back, it's the same routine, and then it's just stuck. The life is stuck.
My life before this, I was a digital designer. It was just hard to deal with contract jobs and not knowing whether if I'm able to support my son next week.
When I first started, all over it was a good experience, but I did have some obstacles. With the extra help from Stenberg staff, I pulled through with success.
We work together. If there is any kind of problem, personal problem, or about the education, so we work together, and so that everybody is fine.
We were given all the tools and all the skills that we needed to have in the real world.
Now, I got more confidence that I can do better.
All the comments I got from my preceptor, they said it did not feel like they're working with a student. It felt like they're working with another HCA.
Aide called me one day to come for an interview. And then I got the job.
I have a stable job where I have income coming in, which I love doing. And then with that, I can also invest into my hobbies, which is design now.
I love working with elderly people. I love making a change, giving my minute or two and talk to them, make a difference in their life.
Having this job is perfect for me.
I remember one time I did go back, even though I was already off clock. I went back and went to see one of the residents. And just seeing their faces react to you, even coming back to them to talk to them, it's just rewarding. Not only it feels right, but it just, you're happy, knowing that you're making other people happy. I have a feeling that eventually people are going to realize this is a good, perfect career choice.
I have
Okay, so our healthcare assistant diploma program, as you've seen, mostly they are employed in home support agencies and residential care facilities. But as I've heard from one of the instructors, they're also immersed with nurses, with nursing classes. And so our healthcare assistants, they're actually able to work in hospital settings, if that's something that you would like to do in the future. You would like to do work in a hospital setting, or this is one of the difference compared to a caregiver that we know here in the Philippines. A healthcare assistant can actually be taking care of children as well. All right, so with the healthcare assistant diploma, our program is fully recognized by the BC Care Aide Registry. So there is a registry, a regulatory body of some sort that they maintain the standard of practice for healthcare assistants. Also, once you become a healthcare assistant, you are an essential worker. There is a huge employment demand out of this profession. And the program that we have has a paid co-op. We will have a job placement for you. We will assist you with your Care Aide registry after the completion of the program. And the best thing about this program is that we have 100% employment rate. So I'm going to show you all the details right now. Okay, we have two variations of the healthcare assistant diploma, but the only difference here is your IELTS score or your English proficiency. So maraming magtatanong yan, Jenica, bakit kailangan may IELTS pa? Can we just waive it? Okay, the answer is no. And this is simply because we comply to what the regulatory requirements are. So BC Care Aid Registry requires, okay, the English proficiency results. And if you're a Filipino, you will be required to submit either an IELTS or I think TOEFL IBT is also accepted, and CLBP. So the most accessible to us would be the IELTS. They accept general or academic. So let's start with the BC Care Aid Registry requirement. So according to the BC Care Aid Registry, and I would recommend, if you want, you can Google this, okay? Look for BC Care Aid Registry English requirement. What you'll see there is they will be requiring you an overall score of 6.0, okay? Same with speaking and listening, but nothing lower than 5.5 when it comes to reading and writing. Now, that is the exact same requirement that we have for the HCA diploma if you're going for it under a direct entry. So that means that you will have 8.5 months of paid co-op, and you will have 2.5 months of, 8.5 months for the full duration with 2.5 months paid co-op. So that is our first variation. Now, let's just say that you have your IELTS and it's 0.5 lower. That's okay. We will still accept you. We will just enroll you with a HCA diploma with Co-op International that includes 3-month English studies component. The total duration will now become 1.3 years, and you'll have 6 months of paid co-op. Now, I've already listed the total tuition fee there, and the total tuition fees that we published, that will already include the registration fee, your material usage, your books, co-op fees, student fees, and even your medical coverage for the first 3 months. Now, you don't have to pay all of that in one go. You can just pay the initial deposit. We have a standard initial deposit fee of 5,150, and then the rest can be paid per installment. So do we have any discounts and bursaries? Yes, we do. If you enroll this year, okay, for whatever intake you want to enroll in 2023, kahit January start, April, July, and October start pa yan, as long as you enroll this year, enroll meaning you've paid for your slot with your initial deposit, then you can get an IELTS bursary. This means that once you have your IELTS, you just send us the receipt that you paid for it, and we will credit your tuition fee up to 350 Canadian dollars. Also, we're waiving your assessment and registration fee worth $400. So again, this is only for 2022 enrollees. You'll be saving up to $750. So what are your employment opportunities? Nabanggit ko kanina, one of the things that separate us from the other institutions is that we have a very strong employer and industry relations. And I've also mentioned we have 100% employment rate. This is because we have a lot of employer partners, whether it be public or private. In this case, what you can see from your screen, the students that we have, they're working in the Nanaimo region, and this is actually Sir Israel who's also helping them. They have their LMIAs, so what they just need to complete is the program, and they already have the work offer available to them. So tuloy-tuloy ang magiging process nila from student visa to a working visa. And let's just say you don't want to work in the island, you can still work downtown, because we still have a lot of other employers available. And our employers, some of them, they provide conditional job offers, some of them, they provide the LMIA after the completion of their program. So because we are a private institution, we will not have the postgraduate work permit. Wala po tayong PGWP. And in our case, hindi po natin kakailanganin yun. Just to clarify, the PGWP actually allows you to stay in Canada for you to have an open, it's like an open work permit, right? Um, Normally students, what they do under PGWP is they look for their sponsors. Because we already have employer partners, we already have work sponsors. So we don't necessarily need the PGWP. Students transition from student visa to a working visa. And once you accept a work offer, you're already eligible to apply to these immigration pathways. So just to summarize, Stenberg College has over 30 years of experience in delivering medical programs. We have overall 98% employment rate, and on healthcare assistance, we have 100% employment rate. Our co-ops are all paid. There will be a job placement there. Conditional job offer is also available for you. There's an immigration pathway, and our tuition fees are really affordable, and we have flexible payment plans for you. So if you feel that this is the program for you, then I would recommend that you submit your resume to Roman and Associates so that we can give you a free assessment whether you qualify for the program or not. And with that, that's my time. Thank you so much for listening. Back to you, Rainiel. Thank you.
Thank you so much, Ma'am Jenica. And let me share my screen first. Hi everyone! So, the next step nga po na kailangan natin gawin is you can send your detailed resume for eligibility check to assessment@romanccis.ca. Of course, it's free po. You can send your resume now and we will assess if you're qualified or not for the said program. And don't forget the subject line, assessment for an HCA at Stenberg College po. And of course, if you have question, you can put it in our Q&A box here in our Zoom. And you can screenshot this assessment email so you can submit your resume nga po sa amin. And of course, I think Miss Jenica, we don't have any question from our participants.
All right. Well, thank you so much for
Okay.
inviting me again, Rinal, and thank you
Yes, ma'am.
everyone who watched today.
Thank you so much, ma'am. And to everyone, you can submit your resume right now after this webinar. Thank you so much po.